Hello, and welcome to another Rush Generations Health Education Lecture. Rush Generations and our staff is delighted to be your source of information, resources, and health promotion programs that help maximize your well-being and good health as you age. Today is Wednesday, September 4th, 2024, and I'm Franco Sambataro. I'm the program coordinator for the Shulman Senior Voices. I'll be your moderator for today's lecture, Falls Prevention Awareness. Before I present to you the wonderful panel speakers joining us today, I'd like to first thank Hannah Weitzman for helping with the production of this lecture, helping us manage the chat and other key aspects so that we can all have a great discussion about fall preventions. As always, we're live streaming this lecture via our YouTube channel using the video platform Zoom, which allows us to host a good number of people who join us via phone. Thank you so much for joining us. For those on YouTube, we ask that you please use the chat function to ask questions and/or add to the discussion throughout the lecture. We will make sure to add your comments and questions that they make it to the presenter. And for those of you listening to the discussion via phone, you will also have an opportunity to, at the end, to unmute yourself from audio and ask your questions. We'd like to remind you that all information offered here is for general informational purposes only, and to always seek additional professional advice for situations specific to you and your needs. I'd like to first introduce Dr. Gunturi. Dr. Gunturi is a geriatrician and palliative care physician at Rush University. She is also the Geriatric Medicine Fellowship Director and physician as collaborator curriculum leader for Rush Medical College. Dr. Gunturi has a particular interest in health equity, communication, education, and shared goal setting with patients. Our other co-presenter today is Mary Granados. Mary Granados is a Falls Prevention Program Coordinator for Rush Generations in the Department of Social Work and Community Health. She obtained her Master's of Social Work in 2019 and Bachelor of Social Work in 2013 from Northeastern Illinois University. She is pursuing her LCSW. With over a decade of experience in the field, her diverse background includes supporting refugee children, individuals experiencing homelessness, and significant focus on older adults. Mary enjoys reading thriller and suspense books, baking, and traveling. Welcome you both. Thank you. I'd like to now kick off our lecture to Dr. Gunturi.
Thank you, Franco.
Welcome.
All right. I hope you can see my slides.
We can.
Wonderful. Thank you all for joining us for this talk about falls prevention awareness. As a geriatrician, I am particularly interested in keeping my patients safe and in making sure that I don't get that phone call from the hospital saying my patient has fallen. So I wanted to talk to you all today a little bit about why this matters, what screening we can do as providers for you, and how you can engage with your doctor or your provider about it, and then what you can do at home to keep yourself safe. So let's start with a little bit of background. So how do we define a fall? A fall is an event whereby an individual unexpectedly comes to rest on the ground or another lower level without a known loss of consciousness. The reason this matters, right, is that, again, when you're going to go in and talk to your provider about, hey, I fell or I almost fell, you want to make sure you're defining it properly. What it's not is if you fainted, it's not a seizure. It is specifically if you haven't lost consciousness and it's unexpected, right? It's not if you're just kind of tired and sit down and lie down. That also doesn't count. So why does this matter? More than 1 in 4 older adults falls every year. That's more than 25% of older adults. Falling once doubles your chance of falling again. If you've fallen twice, then you are now considered a fall risk, and your risk of falling more and more times increases exponentially and dramatically every time you fall. Falls are the most common cause of traumatic brain injuries, and every year 1 million hospitalizations result from falls. There's a lot more really scary statistics out there about falling. My intention is not to scare anyone. I do want you to know how important it is, though, and how much impact it can have on people's well being, on their ability to continue to live their lives the way they've been living them. 88% of hip fractures come from falls as well. And there's about 350,000 hospitalizations that come from the consequences of those hip fractures. So this is a pretty significant problem. And people don't always love talking about it, right? So what can make you fall? What are some things that we should be worried about? Things that are going to give you a higher risk of falling. Number one, like I said, a history of falls. If you're somebody who's fallen before, you might fall again. Taking multiple medications, particularly psychotropic medications, and we'll talk more about medications, so I'm not going to dig too much into it right now. Any problems with gait, balance, or mobility. So this can include, mechanical problems like you have arthritis in your knees, or you have neuropathy in your feet, or you have a dizziness issue where you something with your ear and so you're dizzy. Disease processes like Parkinson's disease, for example, ALS, anything that can make your the way you walk or the way you balance yourself, the way you move, anything that can impair that can cause you to have a higher risk of falling. Folks who have an impairment in their mobility that is significant enough that they're requiring mobility aids, that's another population that we worry about. If you're not using your mobility aid, and that's like a walker or a cane or a rollator, if you're not using it properly or you're not using it enough, but you need it, that's somebody that can fall. Oftentimes I'll have patients who come in and say, hey, you know what, doc, I actually don't need a walker. I don't need the cane. I'm fine at home. I can get around. And it's only after I ask another question and say, exactly how are you getting around? Then I find out that that my patient is using the walls and the furniture, right? Kind of using the walls for support, using the couches, using tables. That's somebody that's a high risk for falling. Impaired vision. So impaired vision is significant. You can have anything, ranging from glaucoma, cataracts, simple just, presbyopia or myopia. So you're nearsighted or you're farsighted. Any of those things can lead to falls. The interesting thing is that if you have impaired vision and you wear bifocals, right, which is probably a lot of you, the bifocals themselves can actually be a fall risk as well. So as you know, especially the progressives, right? So the progressive lenses, you have to look down for the near, and then you have to look up for the far. And so if you're not kind of really conscious of exactly where that is, you can easily fall down something like stairs because you're not able to exactly tell how far it is. So something to keep in mind. Other neurological impairments, we talked a little bit about things like Parkinson's, history of stroke. So something that's made you weak, reduced muscle strength. So folks who haven't been super active, right? You haven't just been doing as much as you were in the past. You maybe have had prolonged time in bed, or you had a surgery, and so you've been laid up and you're working on physical therapy. That's a person who's a little bit higher risk as well. Problems with any heart rate or heart rhythm. So if you're skipping beats or you have AFib, something like that. Postural low blood pressure. So this is when, you're fine when you're sitting down, you stand up all of a sudden and the blood rushes down out of your head, right? That's somebody who's at a higher risk of fall. Foot problems. So for example, the foot problems that come from diabetes, hammer toes, bunions, corns in your feet, so you're not quite putting your foot all the way down because you're worried about the pressure of putting your foot down. All of those things are going to contribute to a higher risk of falling as well. Again, my motivation in sharing this list with you is not to be scary, right? The idea is if you know what your risk of falling is, then you can bring it to the right people and kind of figure out how to solve the problem. So medications, I'm going to spend the most time on this because that's what I worry most about. As we get older, our bodies just process medications differently. So part of, I often get the question, why do I see a geriatrician? And this is what I tell people. I say, as you get older, your body changes. It's different. The way you navigate illness, the way you navigate medications, all of those things change. So this can lead to a higher likelihood of side effects. So you already have a higher risk of having side effects just because of the age. And then on top of that, if you're taking 5 or more medications, then you have an even higher risk of side effects. So, if you think about how many medications you're on personally, I bet a good number of folks who are on this call probably have 5 or more medications on the list. You're at higher risk of falling. 3 out of 4 older adults have at least one medication on their list that is linked with falls or car crashes. 75%, right? So part of this is that people don't know. Patients don't know, that their providers don't necessarily always know. And these are medications that can be prescribed medications, or it could be over-the-counter medications. So some prescribed medications that are commonly linked with falls are your antihypertensive, so your blood pressure medicines, especially water pills. So if you're on a water pill and you're peeing a lot and your blood pressure, you notice, your blood pressure kind of starts to fall when you stand up or you get out of bed or you stand up from a chair and you're like, oh, I feel a little woozy, that can lead to a fall. Um, Other medications are pain medicines. So um, things like especially opioids. Your oxycodone, Norco, that kind of thing can definitely cause falls. Um, Benzos. So benzodiazepines are anxiety medications. So they're the ones, not the ones that you might take every day, but the one you might take kind of if you're having kind of a panic attack or something like that. That can be something that causes falls. Gabapentin, which is a medicine that people use for neuropathy, that's one that is often linked with falls. And those are all prescribed medications. We often are under the misconception that if something is safe enough to offer over the counter, that's something that's probably okay to take. But this is really far from the truth. So often includes over-the-counter medications like worst offender is Benadryl. Benadryl has other bad side effects as well, that your doctor can tell you about, but falls is a big one. Tylenol PM, a lot of people can't sleep very well, and so take Tylenol PM. Tylenol PM has basically Benadryl in it, so you don't want to take that. All of these things can cause falls. So and we'll talk more about what you can do about this, but just knowing that, taking medications, taking more than 5 medications, having any medications on your list that you haven't talked to your doctor about, all of those things can increase your risk of falling. The other thing that is not on the slide, but I wanted to mention is substances. So the 2 substances I worry about, 3 really, um, mainly alcohol. So alcohol use is linked with falls as well, as you can imagine. So it's directly linked with loss of balance. Prolonged alcohol use over a lifetime can really contribute to that loss of balance. And impulse control as well, right? So that inability to kind of navigate, should I be doing this? Is this where I should be walking? Kind of, making sure that you're able to put one foot in front of another. All of those things are impaired when you have alcohol in your system. So alcohol can be a fall risk. And then street drugs, any street drugs, recreational drugs can lead to falls. One thing that is kind of controversial and not everyone is quite sure how they feel about it is cannabis. So CBD or THC containing products. So that's the different kinds of cannabis products that you can get kind of at a dispensary. those can have a fall risk as well. So especially if you have any underlying, any of the conditions that we talked about before, and then on top of that, you have, you're taking something that has cannabis in it. So whether it's an edible or a gummy, it doesn't necessarily have to be that you're, smoking marijuana, but even if it's just an edible or a gummy or anything like that, that has CBD or THC in it, that can also increase fall risk. So you just want to be cautious what you're putting in your body. Um, Dehydration can cause falls, so low blood pressure can come from that. So making sure that you're drinking enough water. Um, I think awareness, and that's the whole kind of purpose of this talk, is making sure that you're aware of what's going on. So now you're aware, right? Now you've kind of thought about, okay, these are the things that I see in my medical history that concern me. What do I do about it? Right? So you remember that statistic that I said about more than 25% of older adults who fall every year. Only 1 in 10 of those individuals discusses it with their doctor. So this is a problem, right? I can say, I can vouch for myself, at least as a physician, that I definitely want to know if my patient has fallen, um, or even if they almost fell, right? Even if they didn't fall, but they almost fell. A lot of people tend to think that if there's no injury, that, it's not really important enough to mention. That's really not true, right? So if you fell, there's probably a reason, and we want to figure out what that reason is. And if you fell, again, remember, um, your risk of falling again doubles, right? So we want to make sure that you don't fall again. So don't hesitate to talk to your doctor. Ask about any supplements before you take them. Have your doctor assess your gait. So you can have your doctor, or your occupational therapist look at how you're walking. I think we're going to hear more about this later, so I'm not going to get into it. But your clinic, your healthcare providers are equipped to look at this, right? To watch you walk and to see how you do, and give you any tips that you might need to make sure you keep yourself safe. You want to get screened for osteoporosis. So osteoporosis is a condition where your bones get spongy and weak, and you're more at risk of that as you get older. Some people are under the misconception that it's a disease of women. Women are at higher risk because of the loss of estrogen after menopause, but men are also at risk. So everyone should be screened for osteoporosis after the age of 65. We do something called a DEXA scan. It's a bone mineral density scan. It's a non-invasive test. It's basically like a complex X-ray. So you want to get that done so that we know if there's any risk of spongy or weak bones, so that even if you do fall, that you're not going to break anything. If you wear bifocals, as I mentioned earlier, consider multiple pairs of glasses, or consider actual bifocals and not progressives. Just because that has also been linked to falls. At every visit, so at least once a year, but really at every visit, you should be asked if you've fallen, why you fell, if you're taking any new medications that should be worried about. So make sure that your doctor is asking you these things, and if your doctor isn't asking, then make sure you tell them. Because there's so much that we can do once we know what's going on with you. Okay, so now to the meat of it. What can you do? We talked a lot about what the risks are for falling, what can contribute to a risk of falling, how your providers are going to look at you, and what kind of things they're going to look at. We talked about the statistics in the country of how many people are falling and who's falling and where they're falling. It's a lot of scary information. So I want to make sure that by the end of this talk, you all are empowered to make changes so that you can keep yourself safe. So 4 things that we can talk about. Number 1, talking to your doctor about your medications. I've mentioned it a lot. I'm going to keep saying it. Number 2, get your eyes and feet checked. When's the last time you got your eyes checked? Especially if you have something like diabetes or hypertension, but even if you don't, everyone should be getting their eyes checked at least once a year. Get your feet checked. Have someone take a look at your feet and make sure that your sensation is intact in your feet, and that you are not, you're not losing sensation, which would make it hard for you to keep your balance, right? If you can't tell where your feet are, you can't tell what your position is, then it's hard to stay upright. Get stronger through an exercise regimen. And I think our next speaker is going to talk a little bit about this. I want to mention a couple of things about it, but you're going to hear more. And then you want to make sure your house is safe. So let's talk through all the different things that we can do in your house. Um, the text on this is quite small, so I don't intend for any of you to be able to read it, but I wanted to have this there so you can kind of remember to go through the whole house top to bottom. So let's start with the floors. You want to use non-skid rugs. I will tell you, on my way into Rush this morning, I tripped on 3 rugs. I'm not kidding. They were not non-skid rugs. They really should have been. But the corners started coming up, right? And I almost fell 3 separate times on my way into my office this morning. So you want to make sure that the corners of the rugs are down. You want to make sure that they're not rolling up or curling up, because what can happen is that you can catch your foot on the corner of that rug and just go down, right? So you want to make sure that is not happening. If there are any extension cords, wires, like lamp wires, TV wires, anything like that that's kind of going across the room, you want to coil them and put a little, a little Velcro thing on there, or you can tape them. You can tape them closed, or you can tape them shut, whatever you need to do. Or you can tape them onto the floor, that's also fine. But if they're kind of lifted up off of the floor, there's a possibility for your foot to get caught underneath. You want to keep all your pathways clear of excess furniture. Make sure that the furniture you have is kind of logically built. I have a baby, and I'll have 3 kids, but my baby is she's in a high chair, and this high chair is ridiculous because the legs of the high chair come out. And so you think the high chair is here, but the legs are over here, so you trip over it, right? So stuff like that, where you don't really expect it to be in your way and it turns out to be in your way, you want to make sure you don't have things like that. And keep floors clear of things that can trip you. So shoes, books, bags, whatever it might be, just keep it out of the way. So that's the floors. Okay. Stairs, you want to fix any loose or uneven steps. Install handrails on both sides and lights, and then make sure that there's non-slip rubber tread to the steps. Stairs are, obviously a significant fall risk. Anybody who has some vision problems or anyone who has some cognitive impairment that's leading to an inability to navigate stairs, one thing that you can do is paint or paper the stairs so that the rise of the stair is a different color from the flat part of the stair. And what that does is it produces high contrast, and so your eye is better attuned to seeing where the stair is, and then you're less likely to fall attached to that. Rubber tread is of course really important, so you can get the kind of the lining for the stairs. You can just install that so that the stairs aren't slippery. If you have any runners on your stairs, make sure that they're really bolted down. In the bedroom, excuse me. In the bedroom, you want to make sure your lamps are easy to reach, so you're not kind of like trying to lean across and then trying to get around your room in the dark. Have night lights. They can be motion detector night lights, so they're not bothering you while you're asleep. But then that way, when you wake up in the middle of the night, you have to go to the bathroom or something like that, it will light up so you can see your way. Install a phone on the floor in case of emergency. So if you do fall, you don't want to be stuck. So make sure that you have something accessible there. A phone is great. A life alert also is good. It's a little necklace that you wear and you can press that. So that's in the bedroom. You also want to make sure that your bed is not overly high. You don't want to have to climb into the bed. If you're able to sit at the edge of the bed, that's good. And that way you're not hopping out of the bed when you get up in the morning. In the kitchen, you want to make sure that you're using things that you're using frequently. You want them close to you. Don't put don't put your salts like 10 feet up, right? And don't use a chair as a step stool. Make sure you have a good, solid, stable step stool in your house. And don't try to climb chairs or tables, right? Because those can be pretty dangerous. In the bathroom, you want to make sure that you're installing grab bars next to toilets and inside showers. You can use non-slip mats inside the bathtub and outside as well. A lot of those chenille and plush bath mats are useless and you'll slip on them. So there are ones that have a non-skid bottom, so those are good. You can also use the stone or diatomaceous earth ones. Those are really good as well because they're really solid and they can't slip and you can't slip on them because they're rough. And then consider a shower chair. So if you're somebody who has just a walk-in shower, excuse me, you can have a chair where you can sit down in the shower. If you have a bathtub, you can have a tub bench. The tub bench kind of comes out of the tub so that the outside of the bench is on the outside of the tub. You can sit down on the side of the tub and swing your legs over into the tub. And that way you're not trying to climb over on one foot because that can be pretty problematic as well. The other thing is your own footwear inside your house. So a lot of people like to wear house shoes. That's fine. I worry a little bit when my patients show me their slides that they're wearing inside. They're like plastic slides that don't have any tread on the bottom. So make sure whatever you're wearing has non-slip grip. So it can be, socks that have non-slip grip on the bottom. They make those socks, slipper socks that have tread and grip so that you're not sliding around on your floors. And same with slippers. Slides can be really problematic, slides or flip-flops, right? Because if you're wearing those at home, what can happen is that that your footwear can actually get caught either on the floor or under a wire or a rug or anything and catch your foot and then you can fall using that. So something like a mule is better, or like a full slipper that covers the front and the back of your foot so that it's not sliding around on your foot. And your foot is secure inside the shoe. That's helpful to have. And a lot of people do prefer, I mean, we live in Chicago, it's cold. We don't want to have bare feet in the house. That's reasonable. Just make sure you're making a good choice about what you're wearing inside the house. I think those are the main things with your home. And doing some sort of cycle through of looking at your home and making sure that everything is safe is very reasonable. Because things move around. You might have family members that come by. You might have, grandchildren who are throwing their things around. I mean, Legos are awful. We all know that. So we want to make sure that you're kind of doing a sweep through frequently to make sure that things aren't, that nothing has changed and that things aren't getting in your way. So a lot of these same rules apply with your car. So if you're trying to get in and out of your car, you want to make sure that you're doing it safely. Same with the shoes, same with wires. Make sure that your garage space or your street space where you're getting in and out of your car is clear. Other risk, again, living in Chicago, snow and ice. So you want to make sure that you have the right kind of footwear to get around in the snow and the ice, that you have salt. If you are not able to do that for yourself, then make sure someone else is doing it for you. A lot of injuries that happen because people are slipping in the ice and the snow. So make sure of that as well. So those are all ways to make your environment safer. As far as getting stronger, Tai Chi has been known to prevent falls. And I think Mary's going to talk a little bit more about that. Physical therapy is your friend. If your physician offers you a physical therapy referral, take it. If they don't offer it to you, ask for it. If you feel like your body is not as strong as it used to be, or that there's something holding you back from being strong enough to do the things that you want to do the physical therapy. It'll make you stronger, but it'll also make you more confident, right? A lot of the falls that happen is because of fall aversion. People are scared that they're going to fall, and that's reasonable. And so they don't move as much. And when they don't move as much, they become weaker and less mobile. And it becomes a really vicious cycle. So physical therapy is your friend. Go ahead and You know, we have a wonderful physical therapy department here, but there's also plenty of others all throughout Chicagoland. You know, find the one that's going to work for you, and you know, find the exercises that are going to work for you and that you enjoy, so that you can stay stronger. Stay mobile. Don't become sedentary. I tell my patients that even if they're watching TV, get up when you are, you know, when there's a commercial break, and just walk around the room. That's all you have to do. You don't have to do anything else. Just walk around the room. There's enough commercial breaks on television that you will get some activity, right? And that constant needing to get up and sit back down, that's going to be helpful as well. And then don't be afraid of using your mobility aids. So your walker, your cane, your wheelchair, don't be afraid of using those. Okay, so for those of you who are at home and can do this with me, I'm going to talk you through an exercise that you can do at home, and that's pretty easy to do, and easy to learn. And this can be kind of your first step towards getting stronger. So you'll find a sturdy chair. So my chair is a rolly chair, so I wouldn't do it on mine. You want to do a good, solid, you know, four-legged chair that's not going to be unsteady under you. You're going to sit towards the front, so you're kind of, your feet are flat, your knees are bent, you're at like a 90-degree angle, and you're not sitting all the way back in the chair. And your knees are going to be a shoulder width apart. Rest your hands on the seat on either side of you. For those of you who can see the image here, you can see how the graphic is. Rest your hands on the seat on either side of you. Keep your back and neck straight and your chest a little bit forward. Now you're going to breathe in and you're going to lean forward. And then as you breathe out, you're going to stand up using your hands as little as possible. Now, this is the key. The ultimate goal of this exercise is to do this without using your hands at all. That means your postural muscles have gotten stronger. So, so again, you're going to sit at the front of your seat, feet square on the floor, knees apart, and you're going to breathe in, lean forward, and then breathe out and stand up. You're going to stand and pause for a full breath in and out, and then you're going to breathe in again as you slowly sit down. And this is the second key to this. The first key is don't use your hands. The second key, breathe in as you sit down. You're not going to collapse back into your chair and like kind of flop, right? You're going to go down as slowly and as controlled as possible. So you want to do this about 10 times, as many times over the course of the day as you can, right? But 10 repetitions in one set. If you can do this, and if you can get to a place where you are not using your hands as you get stronger, then you are going to do yourself a really great service, because it's going to strengthen all the postural muscles in your thighs and your buttocks and your lower back. And that's going to make it much more easy for you to stand and to keep yourself upright, to not fall, and to just really be more, you know, more independent and more able to do things for yourself, without worrying that you're going to fall and break something, you know, hurt your head or something like that. So that is all I have for you all today. If you have any, of course, we have time for questions at the end of both presentations. If you have any other questions, if you want to reach out to me, my email address is on the screen. It's my first name, so NIVEDITA_GUNTURI@rush.edu. I'm a faculty physician here at Rush, and I am happy to answer any questions. And thank you so much for this really great opportunity to talk with you all.
Thanks again, Dr. Genturi. We appreciate your time, and please stick around. As you mentioned just a second ago, we will be having time for a question and answer portion after Mary's portion of the lecture. So for those that are on the call or on the chat, please feel free to, for those on the chat, please feel free to send those questions as we're speaking, and Mary will be joining us next to do her portion of the chat.
Hi, everyone. Thank you so much for joining today's lecture. So today I will be talking a little bit about balance screenings and falls prevention programs. Again, my name is Mary Granados and I'm a falls prevention program coordinator. So the agenda is balance screenings and falls prevention programming. So what is a balance screening? Licensed professionals or doctoral students administer 3 exercise exams to test your balance. The first one is timed up and go. If you're not familiar with this exam, it's basically we have a patient sit in a chair and they walk for a length of approximately 10 feet and then they return back to the chair. The 4-stage balance test, we have the patient stand in 4 different positions, which include standing with feet side by side. And one of them is also when the patient is asked to raise 1 foot and stand on 1 foot. The last one is a 30-second chair stand. So here we ask you to sit down on a chair, and for 30 seconds, we'll ask you to repeatedly sit and stand. Um, so each balance screening can take approximately 8 to 10 minutes. Um, After you complete the exam, your results will indicate if you are at low, moderate, or high risk for falls. Once you complete the exam and you have your results, you will meet with a community health worker who will review your results and give you alternative different steps that you can take to prevent falls or as I will mention, some of our workshops are also mentioned during this portion. And then you will receive the results once the screening is completed for you to share with your primary care physician. So who should get screened? Anyone concerned about falls, anyone who has had a fall or multiple falls, anyone who feels unsteady or dizzy when standing or walking, anyone who's beginning to limit their activities because of their fear of falling, anyone experiencing issues with their balance, or even curiosity can be a reason why some individuals may choose to get screened. I know Dr. Ganturi spoke about a lot of um, risks that are for high fall risk. So it's important to like just check out your if you have low blood pressure or even heart conditions. So this is just a very small list, but there's can be many reasons to why someone can get screened. So what happens next? Anyone who completes a balance screening can discuss with their primary care physician any steps they can take to address balance concerns or any steps to improve their balance. Patients are given information regarding falls prevention evidence-based workshops that are hosted at Rush or in the community. Some of these workshops are A Matter of Balance, Fit and Strong, Tai Chi, bingo size, and I know we also have Walk with Ease that's also offered at Rush. So where can I get screened? You can contact your primary care physician and schedule a balance screening at your preferred medical facility. At Rush, we also offer balance screening events and also in the community. Where we host events. So as you can see, we have a few upcoming balance screening events. Feel free to screenshot or take a picture of these dates. We have September 20th from 10 to 2 p.m. at Southwest Senior Center. So that's in the South Side. Then we also have September 26th from 10 to 1 p.m. at Central West Regional Center, which is about a 5-minute drive from Rush. And now we're going to talk about falls prevention programs. So the first one that I mentioned earlier, Matter of Balance, is a workshop that helps individuals learn strategies on how to overcome your fear of falling to return to higher social and physical activity levels. It can meet twice a week for 2 hours for 4 weeks, but we also have an option of once a week for 8 weeks. It talks about everything you would like to learn about falls prevention and more. How to get up safely from a fall. During one of our sessions, we bring a healthcare provider who demonstrates how to get up correctly and is also available to answer questions during this portion. Fall prevention exercises are specifically designed for the course. So starting session 3, we start with a 30 to 40-minute portion of exercises. They're all done seated down or sometimes standing, and we use chairs for support. Again, we don't force anyone to do any exercises that they are not able to. We encourage you to just be mindful of your own body's ability. It takes a holistic and comprehensive deep dive into strategies to enhance balance and falls prevention. We also share communication tools with family and friends about what's important to us. Something that we strongly talk about during this workshop is how to better communicate with friends and family, as sometimes it may be difficult to communicate with family. Sometimes we may think, oh, they're pretty busy, you don't want to bother them, or sometimes just that fear of losing your independence. Um, we also talk about navigating tasks of daily living and being our own best self advocate. We encourage you to advocate for yourself because only you know your body's limitations and anything that you may be struggling with, or it's best to be assertive and encourage you to talk to your doctors about anything that may be going on with your bodies. Oh, and then our next session, we do currently have a matter of balance that is starting this Thursday. We had session 0 this past Tuesday, but session 1 will be this Thursday at Rush from 10 to 12 p.m. And then a little more about matter of balance. It helps reduce your fall risk and improve your balance during this 8-session workshop. So participants will learn how to view falls as controllable, set goals for increasing activity, home modification tools to reduce fall risks. I know Dr. Ganturi went over a picture of a house and the bedroom and the kitchen and some fall risks. So during this workshop, we also provide you with a checklist that also comes with each room and helps you identify what are some fall risks in each room. As I mentioned earlier, we have exercises designed to increase strength and balance, a comprehensive home safety checklist, reframing of the way we think about falls. So an action we can control rather than an event that just happens to us. Next, we have Fit and Strong. So Fit and Strong meets 3 times a week for 1.5 hours for a total of 24 sessions. Although it is 24 sessions, we allow you to attend a minimum of 17. And again, with all of these workshops, we provide a certificate at the end of each workshop showing that you completed the workshop. So Fit and Strong helps improve lower body strength, regain more mobility and balance. It reduces pain and improves function of your lower extremities, lessens anxiety and depression. And then this workshop also uses flexibility and strength training, such as aerobic walking and health education to improve balance and strength. We have our next session starting September 18th, and it will run to November 13th at Rush on the Rush campus. It'll be Monday, Wednesdays, and Fridays from 1 to 2:30 p.m. For this workshop, we provide ankle weights and elastic bands, and we also show you how to get up correctly from a fall. So towards the end of the workshop, we will place some mats on the floor, and each one of you will learn how to get up. Then for Tai Chi, for arthritis and falls prevention, it is a 2 1-hour class weekly for 8 weeks. It is offered on Zoom. Unfortunately, we don't have it in person yet, but it is on Zoom, which makes it accessible for a lot of individuals who are out of state or traveling. They can join when the session is running. So they do warm-up exercises. There's 6 basic Tai Chi movements and 6 advanced Tai Chi movements. There's standing or seated, and participate in 11 of the 16 classes to complete the program and earn graduation certificate. So the next session starts September 25th and it'll run November 15th. And again, it is virtually via Zoom, and it'll be Wednesdays and Fridays from 11 to 12 p.m. And last, we have Bingo Size. So it is a 10-week program that combines the exciting game of bingo with falls prevention exercises. You come and meet people twice a week and learn new techniques for preventing falls. Bingo Size is for the mind, body, and spirit. It's a lot of fun. Upbeat and fun music is played during the exercise portion, and game winners select from an assortment of prizes that we provide. Bingo Size, to get a visual, it's we do 3 rounds of bingo, and then we do a couple of exercises, and then we do another 3 rounds of bingo, and then do a few more exercises. So the next one that we have coming up is at Central West Senior Center. It'll be from September 17th to December 5th on Tuesdays and Thursdays from 10 to 11 a.m. And they do have a parking lot, which will be available if anyone decides to attend. Another program, a few more program benefits. It improves upper and lower body strength, gait, balance, and range of motion, improved cognitive function, improved social engagements, and improved knowledge of falls risk prevention and important health topics. So if you're looking for an opportunity to be social, this is a great way to participate in something and make friends and, get some exercise in. And then here is my information. Feel free to contact me via email or by phone number. I am the program coordinator, so we're constantly releasing information of upcoming workshops. So if you have any questions, just feel free to contact me. Thank you.
Thank you so much to you both, Mary and Dr. Kunturi, for such a wonderful lecture today that you've shared with us so much information. At this point, I'd like to invite the folks that are joining us via YouTube and here via call to for the question and answer portion of the lecture. So if you are here on the call, feel free to unmute yourself by pressing *6. If you have any pressing questions or just general comments about the lecture, or just a question that you have for either one of our panelists, please take that opportunity now to press *6 and unmute yourself. I see one is unmuted.
Hello, can I ask you something?
Yes, please.
Thank you. I didn't get the contact information for the 2 doctors, for the Ari and the other, and Dr.
Dr. Kuntari and Mary Granados, who works with us at Rush Generations. Yes, I'll make sure to have them provide that as well one more time.
Okay. And then I was going to ask a question too.
Yes, please.
About his asthma. My asthma's progressed, and I don't know if I fell the other day. I just wondered if that has anything to do with it, or if it's a heart problem. But it's a scary thing, or dehydration. We don't know.
Yeah, that sounds scary. I think, asthma in and of itself doesn't usually cause falls, but if your asthma is severe enough that your oxygen levels are low, or if you're
Right.
feeling sick, so you're not drinking enough water, like you said, I think those are both possibilities. I would encourage you to call your doctor and have them kind of go through an evaluation with you to figure out exactly what happened and if these things are related. I appreciate that you're thinking about it and you're making these connections. So that always is helpful for your doctor. You can say, hey, you know what? This is what happened and I'm worried. Here's the conditions that I'm thinking about. What do you think?
Or if it's not a heart problem.
I hope so, and the best person to figure that out is your doctor. So, I wish you good luck, and I hope that you get an answer.
Right, right. What do you do with asthma? I mean, there's no cure for that.
Well, there's definitely ways to control it, even though there's not really a cure. So there's definitely things that we could do.
Hmm.
You know, we would just need a lot more information. So
Right,
yeah, I hope that you have a doctor that you feel confident in, and you're, you know, I would
right.
you to talk to them soon.
Thank you. What is your, you listed in the geriatrics department?
I am, yeah. If you look up Rush Senior Care, I'm there. My name is Nivedita Gunturi. It's
Uh-huh.
Ivedita, and last name is Gunturi. But yeah,
But it's a beautiful name. It must mean something.
it, thank you. It does. It does. It's a Sanskrit name, but
Oh, I see.
yep. So yeah, you can find me on Rush Senior Care, and
Okay.
any questions you have. Okay.
Thank you very much, Doctor.
Thank you.
Again, if anybody else has any other questions that are on the call, this is the time to do so. Please press *6 to unmute yourself. In the meantime, I saw a question that came in from our chat. And Dr. Genturi, why do you think we have such a small number of falls reported? And can you tell us why that is, or why it's so important to report falls to our medical professionals?
Yeah, that's a great question. I think that, you know, people are used to being strong and independent. And I think it's scary when we fall, right? We don't know why and we don't know what happened. And it feels like your invincibility cloak is gone, right? And all of a sudden your armor is gone and you're like, oh my gosh, what's going on? What does this mean? What is all, you know, what so many possibilities, right? So it can be really overwhelming. And I understand that. I think the other problem is that a lot of people have family members who are going to worry even more. So they don't want to admit it because, you know, they're like, well, my son's going to worry, my daughter's going to worry, then they're not going to let me go anywhere and they'll make me sit in the house. There's a lot of things that play into our decision to not tell a healthcare provider. My advice to you is that if you have a good doctor, right, our goal is to keep you independent, active, mobile, and doing the things that you want to be doing as long as possible. So we are completely motivated and incentivized to keep you from falling again. So if you tell us, then we can help you figure out what happened and help you prevent it from happening again. So I strongly encourage that you tell your doctor when these things happen. If you don't trust your doctor enough to tell them that you fell, you probably need a new doctor.
That's great advice. Thank you so much. I see a caller who has unmuted themselves. Go ahead, please.
Well, I wanted to thank you for this presentation because there is a need for more awareness about fall prevention. But I have a fused ankle from a traumatic ankle injury that I had sustained about 10 years ago. And as I've aged, I stumble more and I have fallen. And my experience is when I go to see a healthcare provider, usually the person, the nurse's assistant who takes vitals might go through a screening and say, have you had any falls? I'll say yes, and it's just on to the next question. And that has happened to me several times. I also mentioned it to a couple of doctors, and it was like on to the next thing. So maybe what I need to do is ask them to give me some recommendations or to assess it further.
Yeah, I think so. I think you know, a lot of times what happens is that your provider or your physician is coming in with their own kind of agenda for the day, right? There are things that they're kind of thinking about and that they've had on their mind as stuff that they want to address with you, and may not realize that this is something you're worried about, right? Different doctors
Right.
are different. Some, you know, there are doctors out there who will definitely ask you those questions, but not everybody does. I would encourage you to feel empowered to advocate for yourself. or to bring someone with you who you feel can advocate for you. If you have a relative or a friend or, you know, somebody who you feel speaks up for you when you can't, or when you don't feel able to, that would be a good kind of backup plan to have, and just bring it up and say, hey doc, you know, this is something I'm worried about. What do you think we can do? Can you give me some advice, and can we look into this further? That's what I would.
Okay. The other part too is that sometimes I just feel embarrassed to tell people, because I have fallen a couple times and mentioned it to my sister, and she just gets hysterical about it. I think she's overreacting, but possibly not. But I found myself not telling her anymore because I'm embarrassed.
Mm-hmm. Well, you answered the first question very well, right? About why people don't tell anyone. This is why I absolutely understand that. Um, as we saw, there are so many reasons for falls, right? So many legitimate reasons and risk factors that make people fall. It is not your fault. It is not your fault if you fall. It means that there's something, you know, Mary said something lovely that I really liked. She said, you know, a fall is it's not just like it's not, doesn't have to be a thing that just happens to you, right? It's not, it's something that we can control, and we can, you know, we are empowered to kind of do the things that we can do to prevent that from happening. I liked that a lot. Um, I understand being afraid of telling family. I would hope that your doctor would be a different situation. I would hope that your doctor would be somebody who could hear you non-judgmentally. And I wonder if your sister's hysterics are, you know, because she loves you and is worried about you. And I understand that that's also a heavy burden for you. Um, so maybe start with talking to the doctor, right? Like maybe that's the low-hanging fruit. Maybe that's the easier thing to do. We do that first, see how that goes, find some ways to control it. And then if you do tell your sister, you can say, hey, I fell, but I'm also doing all of these things to prevent me from falling again. And maybe that'll help put her mind at ease, and then your mind will be more at ease.
Okay. Thank you.
Thank you.
Thank you for the suggestions.
Thank you again, Dr. Cantore. Great question. Thank you for being so vulnerable with us. Also, don't forget that we offer those wonderful workshops through Rush Generations, as Mary just plugged some of them, Bingo's Eyes, Matter of Balance as well. And we also have another lovely workshop, I believe it's called Taking Charge of Your Health, and that definitely covers a multitude of topics. One is how to advocate for yourself with medical professionals. So definitely take a look at our offerings for you as well, and follow and heed Dr. Cantore's advice to be honest with your doctor and speak with them. Another question that came in, I think we only have time for one or two more, if you all can bear with us, is do prescription lenses, do prescription transition lenses that darken when one moves out of bright light increase fall risk?
That's a really good question. I think they can. So I think they're more likely to cause falls if you have something like cataracts, where your vision in the dark is already a little bit compromised. That is something where I would worry. My parents both wear the transition lenses, and I've noticed that they come inside and the lenses are still dark for a while, right? And it takes a long time for them to kind of come back to being normal lenses again. And you know, if you're in a dark room and your lenses haven't come back, and you know you're wearing these sunglasses, your options are either to wear sunglasses in a dark room or take off your glasses and you lose your corrective power. So I personally have told my own parents to maybe try different glasses because I worry about them falling. So that's a really great question, and shows that you're really thinking about all the different things that you know you're using to you know to make sure that you're staying safe. I would be cautious. I would be cautious. It's not something that I would say absolutely not, don't ever do it, but I do think it's worth thinking about.
Something I never thought of myself. So thank you for that question and for thoughtful answer. Mary, somebody's asking, are there any eligibilities to joining the falls prevention programming, or can anyone join?
That's a great question. Anyone can join. There's no age requirements, or we don't ask for any type of insurance. So yeah, anyone can join.
Thank you so much again for that question. I know that we're coming to time, and I want to be very and I just want to take this opportunity again to thank you so much to Dr. Genturi and Mayor Granados for joining us today in this wonderful lecture. I wish we could continue because I have so many things that have come up in my own inquisition as my mother is now reaching an older age as well. So thank you again, everyone, for joining us. And now I'm just going to talk about our upcoming events. Medication brown bag screening. You've heard over the past hour about the importance of fall prevention. So we hope you join us this month to celebrate and learn how we can all be proactive in preventing falls. We have a special event this year, a medication brown bag screening taking place on Tuesday, September 24th. Did you know that some of your medications can be contributing to your fall risks? Sign up for a 30-minute consultation with a pharmacist or pharmacy fellow to review your medications for interactions and safety. They will also discuss ways to prevent and manage side effects and how to get connected to services to potentially reduce your medication costs. Appointments are 30 minutes between 10 a.m. and 3 p.m. at Rush campus. Appointments are required and space is limited, so please register by calling 1-800-757-0202. And lastly, we'd like to remind everyone of Shaman Senior Voices. Shaman Senior Voices aims to empower older adults to discuss what matters most to them as they age. It is important to share what matters most to you with your physician and loved ones. Shaman Senior Voices wants to hear from you. Please consider sharing your wisdom on why it is important for your healthcare team and loved ones to know your goals and wishes and what matters most to you at aging.rush.edu/Shaman/collaborative-and-connect, or scan the QR code at the screen to record on a mobile device or smartphone. Our next lecture will be Medicare 101, Wednesday, September 25th, starting at 1 p.m. as always. Again, I'd like to take this opportunity to just thank you for joining us. And if you have any questions or would like to get more information about Rush Generations, please don't forget to reach out to us via phone at 1-800-757-0202 or visit us on Facebook at facebook.com/Rush Generations. Again, please take care, and we hope to see you in our next lecture.